I'm going to go over barium enema and explaining the procedure to a patient. So for a barium enema, you would always get the room prepped before your patient comes in so they don't have to watch you fill your barium bag. What you're going to do is go get your patient, have them get undressed. Dressing instructions are going to be, I need you to take everything off, including your underwear, and put the gown on so that it's open in the back. I don't recommend you leaving your socks and shoes on because sometimes that barium can make a mess, and I wouldn't want you to get it on your socks and shoes. If you'd like some hospital footies, I can give those to you so you don't have to walk around barefoot. After they're dressed, I'm going to have them come into the room. Can you tell me your full name, date of birth? Is there any chance of pregnancy? And the doctor ordered a barium enema on you today. Does that sound correct? We're going to look at your large intestines today. Okay, good. So they told you some prep instructions. Did you follow those? Nothing to eat or drink for the last 8 hours, and they gave you a laxative to kind of help clean everything out. Did that work? So were your last bowel movements just clear, watery stool? Okay, good. So I will take one image to start out with before we do anything to make sure that everything's cleaned out and that prep did work before we proceed. So the doctor ordered a barium enema on you. Do you know why we're doing this? What's going on with you? So you're having some pain or some change in habits of your bowel movements. Okay, where's the pain at? Can you point to it? How long have you had the change in the bowel habits? Okay, do you have any blood in your stool? Do you have any bloating or distension in your abdomen? Have you had any recent surgeries on your abdomen or scheduled for any surgeries? Had you have any scopes done where they either put a camera down your throat or up your rectum or a colonoscopy recently? Have you ever had any surgery at all on your abdomen? Nothing? Okay. So I'll go through and explain the procedure. Have you ever had that here before? Okay. Have you ever had the procedure anywhere? Well, we'll go through and explain it. So what I'm going to have you do for this is I am going to have you, starting out after I take that first initial image, I'll have you roll onto your left side. And what you're going to do is you're going to bring your right leg in front of it. And then what I'm going to do is I'm going to insert an enema tip into your rectum. I do use a little bit of lubrication, so you will feel cold and wet. It shouldn't be painful, but do you, it might feel a little bit of pressure. So I'll walk you through everything and tell you everything that I'm going to do. So once I insert that enema tip into your rectum, I will blow up a balloon on the end of it. Again, that can cause a little bit of cramping, but it shouldn't be painful. The balloon is to help hold the tip in place and also not allow the barium to come out around it. So once that's in, the tubing that we use is flexible so you can move around. So once the tip is in place, I will have the radiologist come in. Once they come in, they're going to put the camera over the top of you, and then we're going to let that barium flow into your intestines, in through your rectum, through your intestines. And then what we'll have you do is we'll have you roll around a bit to kind of coat that, coat the lining of your intestines. After everything's coated and the barium has reached through everywhere we want it to, what we'll do is we will empty the excess back out. And then the doctor's going to use a little bit of tubing on your barium tip there to insert some air, some puffs of air into your colon. What that does is it pushes the contrast up against the lining so that we can visualize everything really well. After we do that, the doctor's just going to continue to take pictures. They may tell you to roll over, roll on your side, roll on your stomach, and I'll help you the whole time moving that tubing around and making sure it's not getting tangled up or anything. Again, the procedure itself should not be painful. It may be a little bit uncomfortable with some cramping and bloating, but that is about it. So if you have any pain or anything like that, just make sure you communicate with us. After the radiologist is done with his camera taking the live pictures, I'm going to take some additional regular x-rays afterwards. After those are all done, what I'll do is I'll go take them to the radiologist, make sure that he doesn't want any additional imaging, and then we'll take that tip out and you can go into the bathroom. Do you have any questions for us? Okay, so after we're done today, just make sure that you drink lots of extra fluid. The barium that we give you can make you constipated if you don't. And then also your bowel movements will be white. for a couple days afterwards. But if you have any other symptoms or any other questions or concerns once you leave here today, just follow up with your physician and they can help you out.